testing kits. Well, I've been speaking with Congressman Bera from California, who's a trained physician that previously served as the Chief Medical Officer of Sacramento County. Thank you so much for taking time to speak with us. This really hits close to home for you because one of the patients who actually contracted coronavirus from an unknown origin is in Solano County, not far from Sacramento. Do we have any update on how exactly this patient contracted the coronavirus?
We don't. This looks like it's the first case of community transmission where the person wasn't traveling and isn't known to have come in contact with someone that has coronavirus. So, this is going to start happening more frequently. We've seen it in China and elsewhere. Again, we don't have any specific contact tracing here. So it's a little bit worrisome.
I mean, Solano County is also the location where many Americans who were infected in Asia have been quarantined. We've had a whistleblower come out saying federal health officials weren't properly given enough protection, that they were able to move freely off of the base. I mean, what is Congress doing to try to contain this virus with all of these fears about its spread?
Well, so we had a hearing yesterday. Again, that whistleblower complaint was brought up at that particular hearing with the CDC and State Department officials. Certainly we're going to look into whether American diplomats and others who were helping transport citizens back to the States had the right protective gear. But other things that we have to do, we've got to speed up the rapidity of tests, the availability of these test kits. We've got to get them to all 50 states so we can do better disease surveillance.
Yeah, and you're a doctor. I wonder what you've made of the administration trying to downplay the threat, basically saying that everything's under control, and also putting the messaging in Vice President Pence's hands.
As a doctor, I think some of what President Trump has done by trying to minimize the seriousness of coronavirus is very dangerous. You want to make sure you have accurate information getting out to the public. When he says, oh, we'll have a vaccine fairly soon, the truth is the earliest we'll have a vaccine commercially available is about a year from now, and that's pretty rapid. So you want the public to trust the information that's being received, so it's not helpful when President Trump gets out there. I'm glad that he put someone in charge. I don't know that Vice President Pence is the right person because the Vice President's in a political position, and this has to be a nonpartisan position and a public health expert.
And very briefly, what would you tell people who are extremely concerned and want to know what best they can do to make sure they don't come into contact with the virus?
I would tell folks that the safest thing to do is, right now the risk in America is relatively low, but continue to do good hygiene, wash your hands, try not to touch your nose or your mouth, et cetera.
Congressman Bera, thank you so much.
Thank you. Have a great day.